Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Federal government releases 4.5 billion naira to 31 federal teaching and medical centers across the country for health workers. "350 Nigerians stranded in the UAE and Pakistan arrive Abuja to undergo compulsory 14-day self-isolation according to the new protocol by the Presidential Task Force on COVID-19. And Italy's scientists say coronavirus traces were found in December, long before the country's first confirmed cases. Nigeria recorded its highest daily COVID-19 infections of 745, bringing the total number of confirmed cases in the country to 18,480. So far, 6,307 patients have been discharged, and the death toll is put at 475. Regionally, the states with the highest cases in the 6 zones are Lagos in the southwest with 7,896 cases. The FCT in the north central has over 1,000 cases. Kano in the northwest has 1,170 cases. Edo State displaces Rivers in the south-south with 729 cases. Borno tops the table in the northeast with 464, while Ebonyi leads once more in the southeast with 234 cases. The federal government has released 4.5 billion naira to 31 federal teaching and medical centers across the country. The sum, according to the Minister of Labour and Employment, Dr. Chris Ngige, is to cover hazard and inducement allowances for health workers for the month of April and May. Dr. Ngige made the announcement in Abuja after meeting with President Muhammadu Buhari. And 300 stranded Nigerians arrived in Nnamdi Azikiwe International Airport in Abuja from the United Arab Emirates. It's the latest arrival of evacuees, which was announced by the chairman of the Nigerians in Diaspora Commission, NIDCOM, Mrs. Abike Dabiri-Erewa, in a tweet. Mrs. Dabiri-Erewa also announced the arrival of another batch of 50 stranded Nigerians from Pakistan earlier today. In line with the new protocol of the Presidential Task Force on COVID-19, all evacuees are to observe the compulsory 14-day self-isolation. This is coming as the federal government earlier assured that Nigerians stranded in countries like the US, the UK, South Africa, Malaysia, France, and others should be brought back home in the next 3 to 4 weeks. Now, over in Bauchi State, the government is working on training health workers to manage COVID-19 cases. Here's our correspondent, Hajra Aliyu, with more.
Bauchi State is thinking ahead and has started to strategize on ways to live with the virus. Recall what the World Health Organization said, that coronavirus is here to stay. What the state government is doing at the moment is trying to scale up management of COVID-19 cases to all its health facilities, including the primary health care centers, especially those ones at the grassroots. The Commissioner of Health, Dr. Aliyu Megoro, has explained this to us.
So in Bauchi, we are starting to register COVID-19 as any other disease of public health importance, like malaria, typhoid, and any other disease. So we cannot do that without training our health workers to have the capacity to understand the disease and also manage it. If you can remember, every local government, we have the disease surveillance and notification officers. We also have the health educators. So this group of people can take over the risk communication and the surveillance activities at the local government. And the general hospital, we have the laboratory scientists, we have the medical officers, the pharmacists, as well as the nurses, who can be able to use their small isolation center in each of the general hospital, so that at least if they can have 10-bedded to 20-bedded capacity to be able to manage a COVID-19 case. We are starting with the asymptomatic, mild to moderate, that doesn't have serious problem and without comorbidity.
The state has reported 438 confirmed cases of COVID-19, and 90% of those cases are concentrated in Bauchi, which is in the southern part of the state, and Azare, which happens to be in the northern part of the state. Azare in Katagum local government area and Bauchi have a population of over 1 million people, and notably, no new case of the coronavirus has been reported in Azare in the last 5 days. In the last 48 hours, 75 people have been discharged from the isolation centers, and so far there are 105 active cases of the coronavirus in the state. From Bauchi, Hajara Aliyu for COVID-19 updates.
Over in Nasarawa State, the government is relaxing restrictions following compliance levels to the safety protocols on COVID-19. The State Commissioner for Health says that out of the number of the total confirmed cases in the state, 27 of them are health workers. He says more sensitization will continue to reduce the spread of COVID-19. Here's Halima Gayam with more.
The Nasarawa State government is worried about the non-compliance to safety protocols by residents. Hence, a stakeholders meeting presided over by Governor Abdullahi Sule to take a stance.
The essence of the meeting today is actually to review some of the decisions that we have taken in the past concerning especially the restrictions on this pandemic that has continued to affect us. If you remember from the last time that we had taken, our numbers of positive cases have gone up drastically.
Over 3 hours of deliberations saw the stakeholders agreeing that the state should maintain status quo and the need to adhere to safety protocols reiterated.
The government at the end of the meeting resolved that the measures as they were, as issued by His Excellency the Governor in Proclamation number 99 last 2 weeks, that's on the 4th of June, will remain. And the task force committees established at all local government levels under the supervision of the local government chairman must continue to ensure strict compliance with the proclamation and any other directive of this in this respect.
Out of the 178 confirmed cases in the state, the Health Commissioner revealed that 27 are health workers from various health facilities across the state.
We do have 27 which are health workers and which are also have tested positive, 6 from FMC Kefi, 4 in the Lata Specialist Hospital, 2 in Nasarawa Egon from General Hospital, 7 in Medical Center Maraba, 5 in the private health facility in Kefi and specific Living Spring Hospital at Kefi, 2 in private health facility in Lafayette M&D Hospital, and 1 newly graduated doctor who is also resident in Karu. It also pleased the entire council to know that about 80% of these were taken from the community infection, not only from the health facility as well as services.
In the past days, the state has witnessed a rise in the number of confirmed cases, with 10 out of its 13 local government areas affected, and 40% recorded in Karu local government area of the state, which shares a proximity with the Federal Capital Territory, Abuja. This informed the decision of stakeholders to move the Emergency Operations Center of the State Task Force to Karu to enable easy data collection. The stakeholders were caught in between 2 decisions, whether to apply more awareness or more enforcement, but it later settled for more awareness. Halima Gayam for COVID-19 update.
And to the southeast, where the Ebonyi state government has recorded its first COVID-19 death arising from complications. The state governor, David Mahi, announced this earlier today in a broadcast. The governor expressed sadness over the death, stating that the state has put in a lot of efforts to ensure that they contain the spread of the virus. The victim was a judiciary officer, and the governor has directed that all the courts in the state be shut down effective today for the period of 10 days, also advising all the judiciary officials, family members to undergo a COVID-19 test within the period. His appeal to indigents of the state to be vigilant and make sure they continue to comply with the precautionary protocols. Now, it is a fight against a global pandemic that continues. How is Nigeria keeping track of the virus as it threatens livelihoods and challenges the very fabric of society? Joining us from Abuja studio is Dr. Alaba Ovie, a medical laboratory scientist and histoscientist with the Histopathology Department, University of Abuja Teaching Hospital. Welcome to the program.
Thank you so much. Good evening, Millicent.
All right, good evening.
Nigerian.
Let's start with your view on the molecular basis of COVID-19. What is wrong with it?
There is nothing wrong with it. We are on right track, but I think we need to look closely to it again. Now, I am of the opinion on three things. First, while looking at molecular diagnosis, we will need to go beyond that, because even PCR itself has its own limitation. For instance, for general detection, you can use real-time PCR to arrive at whether there is a COVID-19 or coronavirus infection or not. But again, the challenge with that is that you cannot establish whether the amplified antigen, okay, is a live virus or is just a virion particle that is there. But for generally, to establish presence of coronavirus, COVID-19 specifically, real-time PCR is good. But again, beyond that, to validate that, to establish whether the virus is a live virus or just a virion particle that established and something even happened to it, you will need to go beyond just real-time PCR. You will need to culture it, and we have the capacity. Okay? And then two, beyond just real-time PCR, we will also need things like next-generation sequencing, targeted next-generation gene sequencing, where you'll be talking about the evolution of the virus, disease progression, and other surveillance. Now, by this, you will establish whether the strain you are dealing with, for instance, in evolution, whether it has undergone mutation that we know with every other influenza family, whether it has suffered antigenic shift, and then we'll be able to know what we are dealing with. Well, that is an advanced one.
Dr. Ovie, I must quickly jump in because it's, it's a lot of technical terms. I mean, how does all of what you're proposing differ from what is available now?
What we have at hand is good. And then I will also advocate, thank God for what Medical Laboratory Science Council of Nigeria they are doing. We will also need RTDs, rapid test kits, those that will be validated with good sensitivity, okay, to be brought on board to augment what is happening, so that by the time that you've screened and you have positive cases, you will be able now to move it to a central lab where you will do molecular testing. But for now, what we have is good, and besides, it's underutilized. It's underutilized. For instance, in Abuja, the Gadua lab has capacity to test over 3,000 samples per day. But so far, how many samples have we been turning out on a daily basis?
So is it time to change our case definition? Is it time to change that?
It is time to change, more so that we have exceptionally horrible community testing at the moment. We need to change case definition. And by the time that we have more rapid diagnostic tool, we will be able to overwhelm the grassroots with rapid testing and then give more opportunity to people that hitherto has been neglected. Okay?
Right.
And then by having such opportunity, by having such rapid testing, massive testing, we will test more. Of course, as of today, we've tested about 108,000 or thereabout. It's good, but not the best.
All right.
Out of 200 million people, we can do more. So I think we will need to upscale sample collection. As we are upscaling sample collection, we also hope that the next batch of validation of test kits, rapid test kit, that is undergoing processes of validation in Lagos by Medical Laboratory Science Council of Nigeria will be fast-tracked. And then by the time that we have a very good rapid test that can pick the antigen or IgM, which will show whether it's a current infection or it's not a current infection, it will be perfect. So that we can give more people opportunity to be tested.
Dr. Alabavier, thank you so much, medical laboratory scientist and histoscientist with the University of Abuja Teaching Hospital. Thank you for joining us.
Thank you, Millicent.
We have more on the COVID-19 update when we return. Welcome back. Let's take you to Imo State, where the government has been speaking on the low compliance guidelines affecting the COVID-19 fight. Here's our correspondent, Deito Prekute, with more.
With the recent statistics on COVID-19 cases, Imo State now ranks second highest in the southeast, with 203 cases to be precise. According to the State Task Force on COVID-19, the spike in the number of cases can be attributed to community transmission and negligence of indigents to the protocols and guidelines put in place by the government to contain the spread of the virus. But not deterred by this, the committee has continued its sensitization across the 27 local government areas of Imo State to educate indigents on the need to comply with the precautionary measures put in place by the government. The recent visit is to Umbise local government area of Imo State, where the committee met with the clergies to educate them on COVID-19 pandemic and how real the pandemic is.
The genomic makeup of this virus was too close to the one they call SARS. SARS coronavirus happened in 2004 and then repeated again in 2014. So we are dealing with an enemy that we have an idea how it performs. There's something in science called the W curve of viruses. When you think that they are down, that's when they make a spike and then kill more people. But our own is even worse. The devil has a trick. One of the biggest weapons the devil uses is to make us believe that it does not exist. And this is what is happening. That's what makes this thing devilish. People are doubting, including some clergy people. Highly rated clergy men and women are casting doubt as to the authenticity of the message that this virus exists. The virus exists.
We'll continue to keep you up to speed with events and happenings around here as it concerns COVID-19 pandemic. From Owerri, the Imo State capital, Deito Prekute for COVID-19 update.
Dr. Ukamaka Okafor is the Director of Pharmacists Council of Nigeria, the Lagos Zonal Office, and she joins us here in Lagos. Thank you for joining us on the program.
Thank you very much.
I'd like to begin by what some are calling refreshing news. The federal government releasing funds for hazard allowance and others. Does that include the pharmacists?
Not yet. We are also aware of the news this morning, but for now, it's just for medical doctors for now. And we are expecting that the government will release the one for pharmacists and other health workers.
So the Association of Hospital and Administrative Pharmacists of Nigeria, I would take it that the Pharmacists Council is also part of that because they've come out with, speaking on recent developments in the healthcare sector, they're not too happy with a lot of the issues, CONMES versus CONHES, also holding a view of the payment of arrears of the call duty relativity. There have been other issues as to more PPEs for pharmacists also in the fight of COVID-19.
Yes, the pharmacists that work in the Pharmacists Council of Nigeria are part of the Hospital and Admin Pharmacy Association. But the Pharmacists Council of Nigeria is the regulator for pharmacists. And as the regulatory agency, we are not also happy with the welfare package that has not been given to the hospital and admin pharmacists. The hospital pharmacists in particular, there has been this CONHES since 2014, that the one for the CONMES, which is for doctors, have been adjusted. But that for the pharmacists has not been adjusted. There's also the arrears in call duty allowance for the past 6 years. There have been so many other things. There have been poor conditions of service. And just like you just mentioned now, the hazard allowance for COVID-19 has not been released, and there's also need for the hospital, the welfare of the conditions of the hospital pharmacists, to be increased. They've been, just recently, I don't know maybe part of the reasons why the money was not released or something, just recently, they called the Union of Health Workers to negotiate with the government, but the pharmacists were not called. And we are thinking that part of the reason is because the pharmacists don't have a union of their own. You see, the Nigerian Ministry of Labour has lumped up pharmacists to belong to other health professional unions. And we're calling on the Ministry of Labour to allow pharmacists to have our own union. Because assuming we have our own union, during that negotiation that just happened recently, they wouldn't have missed pharmacists out, would have been part of that negotiation.
Yes, you probably would have also had to go on strike at one point or the other. But tell us, would you say that it's time to restructure the health sector? Are you saying that, the government is being insensitive, insincere to the plight of health workers, and this is across the country?
This is, the COVID-19 pandemic has presented a lot of opportunities, and it has made us to learn a lot of lessons. In the first instance, we need to develop and implement a strategy for the pharmaceutical sector. When I talk about strategy for the pharmaceutical sector, I mean strategy for research and development of the active pharmaceutical ingredients. For now, we call it APIs. For now, all the APIs to manufacture drugs in Nigeria are imported from either China or India. So we need the government to have a strategy comprehensively that will address research and development of pharmaceutical ingredients, that will address local production, that we address welfare package of staff, that we address other things, information flow, data flow, funds flow, and all that make for. And also, one of the reasons also why we have gaps in the pharmaceutical regulation is because the president of the federation is set to sign the new pharmacy bill into law. And that new pharmacy bill is supposed to give us a comprehensive regulation for the pharmaceutical space. But if it's not signed into law, it becomes a gap, it becomes a hindrance for the Pharmacists Council of Nigeria to regulate the pharmaceutical sector comprehensively. So we need to develop and implement a pharmaceutical sector that is realistic and workable. Right. And apart from developing that strategy, you can't develop a strategy without having an enabling environment and infrastructure, to enable that strategy to work. So as we develop strategy and implement it, the government needs to provide adequate infrastructure and enabling environment.
We hope that the government is listening. We'd like to thank you, Dr. Ukamaka Okafor, Director of Pharmacists Council of Nigeria, Lagos office. Thank you for joining us.
Thank you very much.
Italian scientists say sewage water from 2 cities contained coronavirus traces in December, long before the country's first confirmed cases. The National Institute of Health said water from Milan and Turin showed genetic virus traces on the 18th of December. It adds to evidence from other countries that the virus may have been circulating much earlier than thought. Wear a mask on your face, not your chin, as it has no value under your chin. As we begin the weekend, find the latest guide on the NCDC website on keeping safe, as the centre continues to work closely with states, training health workers to managing COVID-19 patients to recovery. The World Health Organization has the latest updates on the global response to the COVID-19 strategy. The website guides the public health response at national and subnational levels. It's tailored to local context. You can take a closer look at the numbers in real time. Our website, channelstv.com, has more updates. You can find the latest on the pandemic. You can see that in Nigeria, across the world, plus other stories. Thank you for watching. I'm Millicent Morgan. Stay healthy, stay safe.